Good afternoon, everyone. Welcome to another Facebook Live Lunch and Learn with the Center for African American Health. I hope you all were able to enjoy a good Labor Day weekend, take some time to rejuvenate and practice self-care in the midst of this pandemic. Very quickly, I want to remind our viewers that if you aren't registered to vote, you still have an opportunity. The Center for African American Health will be hosting a drive-through voter registration event on September 25th from 9 to 1 in the parking lot of our building located at 3350 Hudson Street in Denver. Please share this information with others and encourage everyone you know to vote. As we wait for a few more people to join, I'll introduce myself and tell you a little bit more about the center. My name is Deidre Johnson, and I am the CEO and Executive Director for the Center for African American Health. For those of you who may be unfamiliar with us, we have been serving the Denver community for more than 20 years. Our focus is the commitment to improve health and well-being for the African American community. We're also a family resource center, and we work to ensure families have the support that they need to thrive. You can learn more about our work and our programs by visiting the website at caahealth.org. And as we move through today's session, please feel free to type your questions in the comment area, and we'll address them if time permits. You know, since the first case of COVID-19 was announced in Colorado on March 5th, this year, the Center for African American Health has been working diligently to connect our community to resources and information amid the chaos and uncertainty of this pandemic. In fact, we initiated our Facebook Live Lunch and Learn series in response to our community's request, really for staying abreast of the latest information on a weekly basis. And one of the things we're really excited about when it comes to being responsive to community is today's topic, which focuses on a new virtual crisis counseling program CAA Health recently introduced to connect community members to helpful resources and emotional support. Now, this initiative derives from the Colorado Crisis Counseling Program, otherwise known as CP, which is funded by the Federal Emergency Management Administration, FEMA, and administered by the Colorado Department of Public Health and Environment, CDPHE, and their Office of Emergency Preparedness and Response. So that was a lot of acronyms. Joining us today is Dr. Curt Drennen. Dr. Drennen is a licensed clinical psychologist who works for CDPHE. He has led the Colorado behavioral health response to over 10 events of significance, including natural disasters and public health crises. Welcome, Dr. Drennen. I'm so glad you're able to join us today so that we can really thoroughly explain this new virtual crisis counseling program and how it may benefit individuals in need of support.
Deidre, thanks so much for inviting me to be a partner in this and join your community. I really appreciate the opportunity.
Thank you. And I have to, this process has been a learning experience for me because in the midst of everything, to find out that actually crisis counseling exists was comforting in a way because I hadn't heard of it before. And so, but first, before we explain the program, would you mind telling everyone about your background?
Yeah, sure. I have been with the Colorado Department of Public Health and Environment for the last 10 years. And before that, I was with the Colorado Department of Human Services for almost 10 years. And for 18 years, my primary work really has been as a mental health, behavioral health, disaster planner, and response coordinator. So I have been working within Colorado systems to really build our capability to respond to, the large-scale natural disasters, as well as the large-scale human-caused events. This is the first time in this program's history that we've actually applied this program, this crisis counseling program, to a pandemic event. Our experience really rests in those natural disaster events. Yeah, go ahead.
So can you tell us a little bit more about what that's fascinating actually, what your role is, as well as kind of further details about what's available Like as a community member, what does crisis counseling, what can that mean to me?
Yeah. So my role has been leading and developing disaster behavioral health for the state of Colorado and really building a system. We've built a collaborative partnership across the state to assure that we've got trained professionals and paraprofessionals to meet the needs of people in the shadow of disaster. So the crisis counseling program specifically is a resource that comes to the state from our federal partners after we've got a presidential disaster declaration. So there are a couple layers of kind of legal requirements where you have to have a local declaration and then a state declaration before you get that national presidential declaration. And it is that national declaration that allows FEMA and their mental health partners through Health and Human Services, SAMHSA, to implement this program at a state level. So this is actually my 8th program to implement. The first one being the wildfires of 2002. The Hayman fire, outside of the Denver metro area. And there were 4 other major fires of significance that year. So we had a multi-regional program that year. But this is by far the largest. Now, the kinds of services that this program offers is definitely focused at the individual, but also really looking at the community as a whole. One of the things that we really kind of consider as a key impact of disasters is how disasters tend to kind of rip apart the fabric of community. In a natural disaster like a wildfire or a flood or a tornado, you have that real damage to homes, to places of living, to businesses, infrastructure, and it tends to scatter people. We don't have that scattering effect with the pandemic, but we do have this requirement to step away from each other, that social distancing requirement that has really kind of ripped at our social fabric. It's kept us from meeting together in places of worship. It's kept us from meeting together in the park or hanging out, having large family gatherings. It's kept us from hanging out with neighbors as we would normally do. And that breaks down relationship. And it breaks down all of our kind of social networks. So the crisis counseling program is kind of a resource to come back into the community, help people creatively identify ways that they can rebuild their social network, but also help them address the stress, the fear, the frustration, the anger that is surfacing right now as a response to the pandemic and the actions that we've had to take in response to the pandemic. How's that? Is that helpful?
Well, it does, and it's so accurate. And I'll share personally that early on, I had 3 cousins pass away on the East Coast within like a week, which was surreal.
Whoa.
But you don't realize until you can't jump on a plane to go to a funeral how much that being able to grieve together really is a part of the whole process.
Yeah. And especially with grief, because grief is such a social process. Mm-hmm. And when we lose somebody, that coming together to process that loss is really an important part of our emotional health. Grief is healthy. Doing it together is healthier.
So our staff has gone through some extensive training through the crisis counseling program in order to offer this new virtual service to our community. We know our goal is to identify the needs of individuals who reach out for assistance, to provide emotional support, education, connect them to resources. Mm-hmm. Can you elaborate exactly how this process works?
Well, honestly, we're trying to figure that out. Simply because in this space of a pandemic, it's required us to be creative. It's requiring us to think differently on how we offer these kind of crisis counseling services. So this virtual world is new. You know, as you were saying, Deidre, just before we got on, you've been in back-to-back Zoom meetings all morning long. And so have I. You know, that's kind of become our world. And so from a mental health perspective, as a psychologist, you know, working with clients, it's a whole new world having to work through a screen instead of being face-to-face with somebody. That changes the dynamic, it changes the connection, it changes the relationship. And so from the crisis counseling program, that too is we're trying to figure out how do we make sure we are connecting with people, because that's the whole challenge, is the disconnect that has happened. So we've got a great team with you in the Center for African American Health that is being creative about how do we connect with the community to provide support, to provide education. You know, we all kind of struggle with stress, and we all kind of struggle with the fear we experience and some of the challenges that are facing our world and facing our community right now. And one of the things that we don't generally know is that stress directly impacts our ability to think, to problem solve, to plan, to make decisions. Stress tends to have us be leery of connection, especially connection with strangers. And so the crisis counseling program is there to help people understand kind of the biology that's happening, but then what we can do to actively challenge the biology and lean into our relationships, lean into creating new relationships to strengthen our resilience in the face of this sometimes really overwhelming stress and fear and anger and frustration that's a direct result of the pandemic and the social elements that are happening right now.
Because, you know, we've got the pandemic, we've got fires. So I can only imagine when you add all those things on top of everything else happening. And one curiosity I have, let's say I'm worried about somebody, but they themselves don't want to contact the counselors. Can I, on behalf of a friend or family member, is the system designed so I get some tips on how to provide them with support to get them to a place where they can reach out?
Absolutely. Our crisis counselors have really been taught on, one, to help identify all the resources that are in the community so that people can have choice. You know, we all want to have choice of who we talk to, especially when we're sharing some pretty vulnerable experiences. And so being able to educate people to be able to be of support to somebody else. And that's where it's most natural, and that's often where it's the, what's the word I want to use? Most helpful, most supportive is when that support comes from somebody that you trust, somebody that you know cares about you.
So September is nationally recognized as Suicide Prevention Awareness Month. And what we often hear is that people who contemplate ending their life feel alone and lack appropriate supports. Can you explain the benefits of a crisis counseling service such as this one and how it may help someone living with a mental health condition exacerbated by the stress of COVID?
Yeah, I mean, just as you said, that experience of isolation, that experience, that lack, that loss of hope. And, you know, the way the kind of traditional mental health system is set up is, if I am a person that is in need of help, I've got to go seek it out. Where the crisis counseling program is kind of designed to be an outreach program, to be reaching out into the community, to be able to kind of let people know, hey, we're here for you. And sometimes that ends up being kind of an interaction like you just described, Deidre, where a crisis counselor or an outreach worker connects with somebody, and that somebody goes, hey, I know John, or I know Sue, I know Curt, and they're really struggling. How can I support them? Can you help me to support them? Or can I connect you to them? And I know in my own times of struggle, um, it's always felt good when somebody reached out to me to provide support instead of me having to ask for support. You know, something I think is somewhat human there, where we all struggle in simply asking for help. Um, and when somebody comes up and says, "Hey, I'm here for you," that in and of itself is really helpful. So with the program being very outreach oriented and going to people, you know, that being a central tenet of the program versus waiting for people to come into the office or reaching out to us first, that can break down some of those barriers and be very helpful to somebody who's really struggling, who's really having that suicidal ideation experience, who's somebody really feeling broken and distant from their normal and natural support system. That outreach component can really have a hugely positive impact.
You know, it's so true. And sometimes it's either cultural or how you were raised. I know when I'm overly stressed, it doesn't occur to me to ask for help. I just start working harder.
Yes.
Just because that's how I
Yes.
was raised. Like if this is happening, you got to figure a way through or over it.
Yeah.
So I'm really pleased that that's the model that the system is taking, because it really meets people where they're at.
Yeah. And you know, it's such a delicate balance because some people that's intrusive. And you know, how dare you, you know, I don't even know you and you're asking me how I'm doing. Um, I'm not going to tell you. You know, I need a relationship first. And that's why that connection, that constantly looking for the connection, which is a core process of the crisis counseling program, is so important. And you know, the Center for African American Health is a major gatekeeper, a major leader within the community. And so you naturally have some of those bridges already built.
So the center is one of 15 local CCP community service providers in the state. What is the vetting process to find organizations to help facilitate the service?
Yeah, the vetting process really kind of comes down to, once again, relationship. You know, knowing of the services community center community provider provides, and knowing that they've got the structures and the resources and capacity to take on a program like this. And our natural kind of go-to has been the community mental health centers that are spread throughout the state. But we actively reach out to other providers this year because of some of our normal natural partners. Their situations have changed because of the pandemic, and they just felt like they couldn't take on a program this year. So we're actively using our resources within the Colorado Department of Public Health and Environment to make connections and identify strong community partners that could partner with us in this program as well.
Well, we're very excited to be a part of the team. So I'm going to take a few moments to share some important resources. First, we want to provide the number to the virtual crisis counseling program we've been discussing today. It's offered by the Center for African American Health. If you or someone you know may benefit from contacting one of our counselors, please call 720-923-7250 or email connect@caahealth.org for more information. All services are free and offered virtually. I also want to share a link to CDPHE's website that contains wellness, mental health, and financial resources. And that's at covid19.colorado.gov/get-help. These will also be placed in the chat by my staff. Lastly, if you're in crisis or are experiencing difficult or suicidal thoughts, please call Colorado Crisis Services at 1-844-493-8255 or text TALK to 38255. You know, Curt, it's interesting. I met someone pre-pandemic who I believe worked for the crisis service line, Rocky Mountain Crisis Services. And it was just interesting to hear her describe about, yes, they have the phone, but for younger people, and especially kids, they were doing much more via text. And sometimes it was just a supportive text when a moment of stress is happening. How do you guys go about making sure you're truly adapting to the different changes on how to support and reach people?
So that crisis line service is through the Department of Human Services and isn't part of CDPHE. So I'm not directly connected to them. Distantly, I know it's an ongoing effort by kind of the public behavioral health system. Is how do we as a system adjust to the challenges of today instead of maintaining a tried and true or even sometimes archaic way of connecting with people. You know, one of the revolutions of the past couple of decades has been our ability to connect. And you know, what our electronic devices have created for us. It's also created some other challenges about what is true connection. And I think that goes from a therapeutic perspective as well, is what are the ways that we as humans connect, especially connect around issues of pain, issues of struggle. What's safe, what is functional. And you know, I think if anything's clear, we are all going through major changes as a society right now. And we humans, how we connect and what our needs are, don't all fit within one lane. And so we've got to be more flexible, and we've got to be able to identify ways that individuals can say, no, this works for me. That really doesn't, but this does. And us being able to meet them in that space. So I think that's kind of the philosophy here. You know, taking on that text to talk process has been important because I know my daughters are much better at communicating through text or FaceTime or something like that versus just picking up the phone call and would never think of writing a letter. So, you know, how we communicate and how we connect is constantly changing. And therefore, our system has got to be willing to change with that.
You know, it really resonated with me when you mentioned earlier that when disasters happen, so much is happening in the shadows. Mm-hmm. And so we have a question today. Are there any words of encouragement for those afraid to seek crisis or mental health services?
Remember, you're not alone. I think that's one of the hardest things to remember right now because we're so isolated. Because of the pandemic, I know I haven't left my home for several days now. That would have never happened 6 months ago. And so we've got to remind ourselves we're not alone and then take the steps to reconnect. Find a creative way to reconnect or identify that family who is safe for you that you can work on having more face-to-face connection with because they're safe and you know what their behaviors are and the chances of them being exposed to the virus is decreased and therefore keep you safe. And don't be afraid to reach out, whether it's reaching out to the Center for African American Health or reaching out to one of the other local providers or just reaching out to a friend. Make that connection. It's really important. And you're not alone in this. We're all feeling disconnected. And we all have a responsibility to connect.
So of the websites I mentioned earlier, because I know we're one of 15, I know our friends over at Servicios are also a part of the network. Where would one go to find out kind of who the closest crisis counselor is in their community?
Yeah, so there is a website at CDPHE, you can look up Colorado Spirit, Colorado Crisis Counseling Program, and it provides a list of all the providers across the state that you can reach out to. They all have a website, they've got a crisis line, they've got a direct connect for anyone, anywhere in the state to connect to.
Oh, that's wonderful. So we just have about 5 more minutes. I really want to thank you for joining us again today. And, you know, as much as you think you know so much, when I first learned about the work that you did, I was just so pleased to know that that was happening. And so thank you so much, because I can only imagine what the planning of it involves. And even with regard to COVID, we know it's not ending anytime soon. So when you think about kind of that long term, is it really helping people manage how to cope where the end the end is not in sight?
Yeah, it's helping people learn to cope for a really long time, and really understanding that we are coping as we're changing as a society, and what are going to be the long-term impacts of these changes. So yeah, I mean, the CCP is here through June, and so, you know, we're going to be a long-term program, and, you know, kind of depending on what this pandemic, how it continues to unfold, that will also have an impact on what resources are further created in the months to come.
Well, again, thank you for the work you do. Thank you for your support so that we can support our community. We are out of time. And so I want to let everyone know this video will be available with other information on the center's website at caahealth.org. Thank you for joining us today. Thank you also, again, Dr. Curt, for taking time out of your busy schedule to spend time with us.
Deidre, it was an absolute pleasure. Thank you for your leadership. Thank you for making the Center for African American Health such a strong community resource. We're lucky to have you.
Oh, thank you. And again, thank you all for joining us today. Next week, our Facebook Live Lunch and Learn, we'll be chatting with Jim Garcia, a friend who is the Executive Director for Clinica Tepeyac. And we'll really just dive into a discussion around the health disparities in the Black and Latinx community. Have a wonderful week, and